My name is Vong Chang. I work for Turning Point Community Programs. It consists of case management services, individual therapy, psychiatric support. A lot of our patients and their family members may be subject to racism. Not only do our patients and their families experience this, we also experience this ourselves. Oftentimes, I would have patients, families of patients, question my abilities and my skill sets. At one point, a family member had even questioned if me being who I am, Asian American, would be a good fit for her son's care. It could be very painful and just agonizing to know that you are treated differently because of your race. I was raised and grew up being subject to racism. I wasn't sure growing up if I even had a voice in a lot of situations. So oftentimes I kind of just kept quiet. It was just easier to not express myself or not be open and transparent about my own emotions. Knowing that there's a propensity for my own mental health to deteriorate because of racism, I seek resources to stop myself from worsening.
Wonderful, wonderful group here today.
Being in the Learning Collaborative was just a very comforting experience to just understand that although we each had our own individual lived experience as a minority, there were a lot of commonalities.
Anyone who's been impacted by systems and structures, particularly Black and brown folks, we are in the constant state of protection, right? It's a real reality for our community.
Hearing others talk about their own journey through this also prompted me to feel safe in discussing my own personal experience.
I always feel good about this space. It's a safe space for, courageous conversation.
Those discussions helped me to discover parts about myself that I really didn't think much about, but now reflecting back, these were very instrumental in building who I am as a provider. So we were provided with tools on how to facilitate discussions and talk about racism in our workspace. So I feel more ready, I feel more willing to have those discussions and really promote that environment so others could come forward and talk about it as well. The staff that I work with needed somebody to be their ally and to help them to navigate those complexities. If they understand more about racism, things have the capacity to respond to it in a way that advocates for patients. And I think that they may also develop some discoveries about themselves to understand that you have the capacity to develop resiliency and to get to a place where you could also help others to transform themselves in their own lives.